A serious warning needs to be heard. Every 66 seconds, another older adult is diagnosed with dementia. Before you finish watching this video, around 20 more families will receive that life-changing news. What many people don't realize is that, in some cases, the cause isn't simply aging. Sometimes it starts with a medication sitting quietly in a bathroom cabinet, a medication that was considered completely safe. I'm Dr. William Lee, and after more than 15 years of working with patients, I've witnessed this pattern over and over again. People who were mentally sharp for decades suddenly begin struggling with everyday things. They forget names, miss appointments, lose track of conversations, or get confused on routes they've driven countless times before. Family members often assume it's just part of getting older. But sometimes it isn't aging at all. Sometimes it's a medication. And the most concerning part is that these drugs are often prescribed by doctors and dispensed by pharmacies, so very few people ever stop to question them. Recent research continues to reveal a troubling reality. Certain commonly used medications may significantly reduce memory and learning ability in as little as a year. Millions of people take them every day without realizing their brains may be paying the price. In this video, I'll walk you through 9 medications that researchers have linked most strongly to memory decline. We'll count down from those that are frequently overlooked to the one I consider the most damaging. Pay close attention to number 3. It is prescribed to millions of older adults for a condition that sounds harmless, yet it may be affecting the brain's memory centers without producing any obvious warning signs. Before we begin, let me know in the comments how old you are and which medications you take regularly. I read your comments, and understanding this audience helps shape future videos. Let's start with number 9. And don't underestimate it just because it's at the bottom of the list. This medication can be found in medicine cabinets across the country. Number 9 is diphenhydramine. Most people recognize it by its common brand name, Benadryl. It's the familiar pink pill many people use to relieve allergies, help them sleep, or ease cold symptoms. It's inexpensive, widely available, and doesn't require a prescription. Because of that, many assume it's harmless. Unfortunately, what it does inside the brain tells a different story. Benadryl belongs to a category of medications called anticholinergics. While that term sounds complicated, the concept is straightforward. These drugs block a chemical messenger in the brain called acetylcholine. This messenger plays a critical role in forming new memories and maintaining alertness throughout the day. As we get older, natural acetylcholine levels decline. That means the aging brain depends even more heavily on what remains. When a medication blocks it, the impact can be far greater in a 70-year-old than in someone much younger. One area especially affected is the hippocampus, a small structure deep within the brain responsible for creating and storing new memories. Throughout my career, I've seen patients take nightly antihistamines for years and gradually experience increasing mental fog without ever suspecting the medication beside their bed. Research supports these observations. A 2023 study published in the Journal of Geriatric Cognitive Health found that older adults who regularly used anticholinergic medications had a 54% greater risk of developing dementia compared with those who avoided them. That's a substantial increase tied to a medication many people treat as casually as a vitamin. Here's an important step you can take. Read the labels of any medication marketed for sleep, nighttime relief, or allergies. Many contain diphenhydramine under different names. If you're using it primarily for allergies, ask your doctor about newer antihistamines such as loratadine, commonly sold as Claritin. These medications are much less likely to enter the brain and are generally considered safer for long-term use. Never stop a medication without medical guidance, but don't assume that something sold over the counter is automatically safe for memory and brain health. Now let's move to number 8. This is a medication that often helps the stomach while quietly creating problems elsewhere. Number 8 is proton pump inhibitors, commonly known as PPIs. Examples include omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications reduce stomach acid production and are frequently prescribed for acid reflux, heartburn, and digestive discomfort. Many people remain on them for years because symptoms often return quickly when they stop. As a result, long-term use becomes routine. What many patients never hear is that stomach acid serves an important purpose beyond digestion. Your body relies on it to absorb key nutrients from food. One of the most important is vitamin B12, which helps maintain healthy nerves and supports proper brain function. When stomach acid remains suppressed for long periods, B12 levels can gradually decline. Magnesium and calcium absorption may also be reduced. These nutrients play essential roles in communication between brain cells. Without them, neurons don't function as efficiently, potentially leading to confusion, forgetfulness, and cognitive symptoms that can closely resemble early Alzheimer's disease. In some cases, the medication itself may be contributing to the problem. A large 2016 study published in JAMA Neurology examined more than 73,000 adults aged 75 and older. Researchers found that regular PPI users had a 44% higher risk of developing dementia compared with non-users. There may be additional concerns as well. Some studies suggest these medications can increase levels of amyloid beta, a protein associated with Alzheimer's disease that accumulates within the brain over time. If you're taking a proton pump inhibitor every day, it's worth discussing your options with your healthcare provider. Some individuals may be able to transition to H2 blockers such as famotidine, commonly sold as Pepcid, which appear less likely to affect cognitive function. Others may benefit from lifestyle changes or natural approaches such as deglycyrrhizated licorice, which can help soothe the stomach lining without affecting the brain. The goal is simple. Use the lowest effective dose for the shortest reasonable period rather than taking a medication indefinitely out of habit. Now let's move to number 7. This medication is prescribed for a condition many people find uncomfortable to discuss. Number 7 is a group of bladder medications, especially oxybutynin, sold under the brand name Detropan. Doctors commonly prescribe it for overactive bladder, helping people manage sudden and urgent trips to the bathroom. For many patients, the relief can be life-changing. However, there's an important downside. Oxybutynin blocks acetylcholine, the same memory-related brain chemical affected by Benadryl. Unlike some medications, it crosses into the brain quite easily and directly impacts regions involved in memory formation. That makes it particularly concerning for older adults who take it continuously for months or years. A study published in the British Medical Journal in 2019 found that adults over age 65 who used strong anticholinergic medications like oxybutynin for more than a year faced a 49% higher risk of dementia. That's nearly a 50% increase. What concerns me most is how rarely patients are warned. They're told the medication can improve bladder control, but few are informed that it may also influence memory and thinking. When cognitive symptoms begin, they are often blamed on normal aging. People notice they are forgetting appointments, misplacing belongings repeatedly, or losing track of conversations. Friends and family may simply shrug and say it's part of getting older. Yet the medication itself may be playing a significant role. By the time someone makes the connection, valuable cognitive function may already have been lost. If you're taking oxybutynin and you've noticed increasing forgetfulness or mental fog, don't ignore it. There may be alternatives available, and no one should feel forced to choose between protecting their bladder and protecting their brain. Fortunately, there are newer medications available today. One example is mirabegron, commonly sold as Myrbetriq. Unlike older bladder medications, it works through an entirely different mechanism and doesn't interfere with acetylcholine, the brain chemical closely tied to memory and learning. For many older adults, it provides the same level of bladder control without placing additional stress on cognitive function. If you're currently taking an older bladder medication, it's worth discussing alternatives with your doctor during your next appointment. Now let's move to number 6. This one surprises many people because it's among the most commonly prescribed medications in the world. Number 6 is statins. Medications such as simvastatin, Zocor, and atorvastatin, Lipitor, are prescribed to millions of adults, especially those over 60. They play a valuable role in lowering cholesterol levels and reducing the risk of heart attacks and strokes. To be clear, this isn't an argument against statins. For many people, they are genuinely beneficial and sometimes life-saving. What often gets overlooked is the other side of the discussion. While cholesterol has a reputation as something harmful, the brain actually depends on it. Nearly 60% of the brain is made up of fat, and cholesterol is essential for building myelin, the protective coating that surrounds nerve fibers and helps signals travel efficiently throughout the nervous system. When cholesterol levels are lowered aggressively, particularly with statins that easily enter brain tissue, some individuals may experience cognitive side effects. A study published in Frontiers in Aging Neuroscience in 2023 reported that adults over the age of 70 who had taken statins for more than 3 years showed a 26% higher rate of mild cognitive impairment. Researchers also noted that higher doses appeared to be associated with greater risk. Some patients describe unsettling experiences. Familiar names suddenly disappear from memory. Conversations are forgotten minutes later. Routes they've driven for years seem oddly unfamiliar. It's important to remember that not all statins behave the same way. Certain options, such as pravastatin and rosuvastatin, are less likely to cross into brain tissue and are generally considered friendlier when it comes to cognitive function. If you've been taking a statin for years and have noticed increasing forgetfulness, confusion, or mental fog, bring it up with your physician. Sometimes adjusting the dose or switching to a different statin may help. What you should never do is stop a medication on your own. If a statin is protecting your cardiovascular health, any changes should be made with proper medical guidance. Before we continue, take a moment to hit the like button if this information has been helpful. It helps the Weird Lab reach more people who could benefit from hearing it. Now let's continue with number 5. Number 5 is benzodiazepines. This group includes medications such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. They are among the most frequently prescribed drugs for anxiety, panic attacks, and sleep problems. They work by increasing the activity of GABA, a calming chemical messenger that slows excessive activity in the brain and nervous system. Initially, these medications can feel incredibly effective. Anxiety quiets down, racing thoughts settle, sleep becomes easier. Many people feel like they've finally found relief, but the story often changes with long-term use. A 2022 study published in the British Medical Journal tracked more than 8,000 older adults over 6 years. Researchers found that seniors who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. Long-acting medications, such as diazepam, appeared particularly concerning because they remain in the body for extended periods and can accumulate within fatty tissues, including the brain. Over time, these drugs essentially place the brain into a prolonged state of chemical sedation. Learning becomes slower. Mental flexibility decreases. Many users report feeling disconnected, mentally sluggish, or as though they're moving through life behind a foggy window. Perhaps the most difficult part is what happens when people try to stop. If benzodiazepines are discontinued abruptly, anxiety and insomnia often return with greater intensity than before. Severe agitation, withdrawal symptoms, and serious health complications can occur. That's why one rule is absolutely critical. Never stop a benzodiazepine suddenly. If you've been taking one for more than a few weeks, work closely with your doctor to reduce the dosage gradually over time. A carefully supervised taper is the safest approach. Fortunately, alternatives exist. For anxiety, medications such as buspirone may provide relief without causing the same level of sedation or cognitive impairment. Specialized therapies designed for anxiety and insomnia can also help restore calm and improve sleep without affecting memory. Now we arrive at number 4. This medication is unusual because it's prescribed for several completely different conditions, yet carries one of the most significant hidden risks on this list. Number 4 is amitriptyline.